All right. So as Rich mentioned, I own Dutton Veterinary Services located in Walton, New York. We do quite a bit of beef and dairy cattle, and dystocia is something that comes up a lot. If you're gonna have a herd, you're gonna breed cows. This is something that you're gonna need to prepare for. So we're gonna talk a little bit about. Obviously, I can't talk about everything today because I only have 50 minutes, but obviously if there's going to be more stuff in here than I can cover, but I'm going to talk a little bit about what goes on, things to look out for before you start calving, because that's going to set us up for success during the calving period and beyond, because it really, if your cows are fed well, they're going to feed their calves well, etc. So just a note that pregnancy determination of your herd is going to be really important, because pregnant animals and open females really have different nutritional requirements. And so sometimes we're checking these guys, and if they're not in calf, we're sending them down the road, okay, if they're not producing, because that's their main job in the herd. But I'm going to feed these groups of cattle differently. We don't want any open females to eat too much and get too fat, because then that'll prevent them or really reduce their chances of getting pregnant again in the future. So it's important to know that whether we're pregnant or not. I prefer ultrasound because I get an actual picture of the calf. So can you see my mouse moving? Yes, no?
I don't. Move it some more.
I don't think it's going to show, but
Oh.
That's okay. So in the pictures on the right side of the screen are some ultrasound images of fetuses. These are about 45 days, 50 days in age. And what's nice is we can actually get an image of the fetus. So on the top image, the arrow and the E there is the little developing fetus. And then on the bottom, that arrow is pointing to the umbilical cord. So I can look at this and say, I can age it. I can give you an approximate age if you have a bull bred herd. I can also look at it and say, this doesn't look right. It looks like she might be losing this calf. And so that's good information to know, so that you can recheck her and change her status if needed. I can also do some fetal sexing at certain ages. But ideally ultrasound gives you a lot of information. I can usually also see twins. So that's something you're going to want to know. Some people like to blot their cows. So they just, maybe you've heard of it called bumping a calf, where you press your fist into her side and move it kind of rapidly and then stop. And then the fetus should bump into your hand. It's not super accurate. When it is accurate, it's only in late pregnancy. So at that point, you've probably missed your window for changing their feed status if they're open. Some people like hormone tests, progesterone tests, things like that. There's a bioprint test on blood. Those have their own set of issues. Some have false positives, some have false negatives. Really, if you want it to be done accurately, you got to have them ultrasound. Just a little bit about gestational care. I mentioned nutrition. Nutrition is really important. We want our cows to be at a certain body condition before they calf. If they're too heavy, they're going to have issues. If they're too light, they're going to have issues, and they're kind of different sets of issues. But we want to maintain a proper body condition. In cows, we're looking at a 2.5 to 3.0 out of 5 scale. Some people use the 9 scale, and that would be like a 5 out of 9, if that makes sense. I can't overemphasize how important mineral is to these guys. It's really important getting them pregnant. In fact, one of the biggest issues I see getting cows pregnant is mineral issues. But also during gestation. So they should have free access to some sort of mineral supplementation. I like to include selenium in that, because we are in a selenium deficient area. That's something you should talk to your nutritionist about, or your veterinarian can give you a better idea of what to do there. I put stress question mark. Obviously, we want to reduce stress in our pregnant animals. I think they handle it better than maybe sheep and goats do, but still it's something to think about. The number of times you run them through the chute or bring them up and give them shots, that kind of thing can take its toll. And then here at the bottom, when you're getting ready for calving season, so a lot of people are going to be calving in the next couple months, you want to make sure your cows are moved to a new pasture. For example, you want them to calve in a clean and dry environment. If a calf is born in the muck, that's going to really set it up for failure. It's gonna have higher incidence and risk of infection. So I was at a barn the other day that the calf was born. The farmer came out, the calf was born, it was laying in the gutter. Well, how do you think that calf's doing 3 days later? Not well. It's got pneumonia and it's hypothermic and it's got a bunch of issues. So you need to put it, some people like to bring their cows in and have them calve in the barn. That's fine. Some people have maternity pens. That's great. Keep them clean. You want to clean them between cows. You want to make sure there's no manure in there for newborns to stick their face into, okay? Because they will, and that's how they're going to get infection. If you're calving out on pasture, great. Make sure your pastures, you move them to a new pasture right before calving, and that it's not a pasture they've been on forever and defecated all over it. Just a note here on how to body score cows. Basically what we do is we look at where the cow deposits fat. And so a cow is going to deposit fat along its top line, along its back, and it's around its pelvis. That's where I look primarily for body condition score. So body condition score of 1 and 2 out of 5 is too skinny. A cow that calves in with these scores is going to have trouble making an adequate amount of milk for their calf. They're going to have trouble getting rebred. Their calf may not reach a good weaning weight, etc. So these guys are a little bit skinny because this type of skinniness is not going to work for them. On this slide, I have the body condition scores from 3 to 5. 3 is ideal. That's what we really want. We have a lot more filling in of the top line here of the pelvis, but you can still see the key with the 3 out of 5 is you can still see the hips, you can still see the pin bones, okay? They start to disappear as we get to body condition score 4 and 5, and that means that our cow is really too heavy. And they're also going to have issues. So if they're too heavy, they're going to mobilize more fat when they produce milk, okay? And that's going to, in dairy cows anyway, it's going to predispose them to ketosis. So we do see less of an issue with fat in beef cows, but it's still potentially an issue. And these fat cows are going to have a hard time getting rebred. All right, let's talk about some conditions we see in pregnant cows. We're going to talk about vaginal prolapse, and we're going to talk about abortion briefly. So a lot of cows do great. They're pretty hardy. They, stay outside all winter. They can eat a lot of foods that we might throw away, like, I don't know, when you put them on a cornfield that's been harvested for silage, they can do really well on that. So they're pretty tough animals. But we do see some conditions while they're pregnant that can lead to issues. So one common condition we see is a vaginal prolapse. And so this is usually only occurring when they're pregnant and late gestation. So on the left side of your screen, there's a picture of a pretty significant and severe vaginal prolapse in a beef cow. And it can range from that kind of severity to something like that's on the right side of the screen. That dairy cow has a very mild vaginal prolapse. It probably is only out when she's laying down. So the severity kind of depends on how you're going to treat it. So vaginal prolapse is a lot more common in our overweight cows. There's also a genetic component to this disease. So a lot of times, you have a cow that has a vaginal prolapse where we want to think about not reproducing with that cow in the future. Treatment of a vaginal prolapse is going to depend on the severity. So if you have the picture of the one on the left, you're probably going to need a vet out to come and replace that and make sure that it doesn't come out anymore. The one on the right, the one that only kind of comes out when she's laying down. It might come in and out, and you might see it sometimes and not others. That's one that probably can be monitored unless it gets worse. So if you do end up having these vaginal prolapses replaced, usually what I do is I put a Buhner stitch in. So the picture in this slide shows a Buhner needle. That's the round part on the bottom is the handle end, and then that's points up at the top with the umbilical tape. And so basically I'm going to use cotton umbilical tape and thread it through the lips of the vulva and tie it together in a nice bow. And all that serves is to keep the vagina inside. It's not even completely everted. It keeps it nice and moist so the tissue doesn't get damaged. And then we basically wait for them to calve. So a cow can calve with a vaginal prolapse, but you do want to make sure if you had to replace that and stitch her up, you want to remove those stitches before she calves. The stitches will not stop her from calving. She will calve and she will rip the heck right out of her vulva, and it'll be a sorry mess. And that itself is going to be difficult to heal, obviously painful, and also can lead to issues getting pregnant in the future. So if they are, you do have to replace those and stitch them up. Just make sure that you monitor that cow really closely and remove those stitches before she actually tries to have them pass the calf, as I have seen some do quite a number on themselves. Another thing that we sometimes see in our pregnant cows is abortion. This just means delivery of a dead calf before full term. It's different than stillborn. Stillborn calves technically are full term. But abortions happen because the calf died in utero. There's a lot of different causes. I don't have a lot of time to go over them. Infectious diseases are super common. Genetic issues as well. So you might just have a calf that had some sort of genetic mutation and it was unable to live. So then if that fetus dies, then the cow will eventually expel it. Twins is a big cause of abortion in cows. They're too big and that's too much for them. So sometimes those will die and be aborted early. Abortions can happen at any stage in gestation. If they're before 45 days, they're generally considered early embryonic death. So not abortion, but it's the same kind of thing. They lost the pregnancy. So the pictures on this slide, I'm not sure how old the fetus on the bottom is. You can see it has no hair, and it's very small. I mean, maybe 120 days. I'm not sure. I don't have a size reference, but that one's kind of middle of gestation, whereas the one at the top obviously has a malformation because it has two heads, and yes, that sometimes happens. That one that has hair, it probably could have been born, but it obviously had an issue. So abortions generally in our cattle, usually we see them as single event episodes. If it happens that you're having more than one cow aborting, that's a reason for concern. So if that happens, you definitely want to call your veterinarian and see if you can work up that disease process. Ideally, you should keep both the fetus and the placenta for the vet to do a necropsy or to send it out to do testing. If you do that, make sure you keep it refrigerated. Don't freeze it. Freezing destroys the tissue. So but if that should ever happen to you, that's a good idea to keep those tissues until they can be looked at. All right, let's move on to actual parturition or the birth process. So parturition occurs in 3 stages. Stage 1 is basically our nesting stage. The cow is going to prepare for birth, and so they'll tend to be restless. They might get a little colicky. the fetus is actually moving into position to be born at that stage. Stage 1 can last 2 to 24 hours. Generally, usually it's shorter, around 2 to 6 hours. But obviously we have a nice wide range, which is, I'm sure, helpful. Stage 1 ends with the water breaking. So one of the amniotic sacs breaks. And then we're entering stage 2. Stage 2 is where all the fun happens. That's when we actually get our calf. Stage 2 should not last more than an hour. So that calf should be, as soon as that water breaks, that calf should be out within an hour. An hour is more for heifers that don't really know what they're doing yet. Cows that have had calves generally will have that calf out in 30 minutes. Okay. And that's ideal because we don't want to spend a lot of time between being in the uterus and on the ground. We want to go from one to the other very quickly. Once the fetus is out, we're on to stage 3. Stage 3 is just passing the placenta. And so generally that takes 8 to 12 hours. Technically, placentas aren't considered retained until probably 24 hours, but it's just semantics. So ideally, our placenta should come out fairly quickly and be gone. So the normal birthing the normal birth position for a calf is going to be front feet first, then a nose and a head, and then the rest of the calf. So in this on this slide, the normal birth position is on the top right, and that has the calf with its front feet extended, head and neck extended, and he's in this kind of diving position, and he's going to come out of the back end of that cow. The other picture on this slide I put on there, it's not the normal birthing position, but you can still be okay. They can still have calves this way. This one has the back feet first. It's not ideal. They tend to, I think the placenta breaks a little faster in this method of giving birth. So sometimes you can still have issues with the newborn calf, but doesn't mean you have to, if you find this, doesn't mean you have to flip the calf all around. Just pull it, back feet first. But this is our normal position that we're expecting. What we're talking about today, though, is dystocia. Dystocia means a difficult birth. And this is very common. And the most common cause in our cattle is going to be malpresentation of the fetus. So instead of that head diving position, we're going to have, the head back or a leg back, etc. So if you think your cow is having dystocia, so let's say stage 2 labor is going on beyond an hour, we need to make sure we get in there and see what's happening. And so the only way we should be doing this is by using proper restraint. And I have a picture here of a cow in a chute. This is the best restraint for working with these animals, pretty much regardless of what you're doing. I know not everybody has the money for a chute. Sometimes you can squeeze them behind a gate, things like that, but you need to control that cow. It's going to reduce injury to personnel, including me, which is super nice. It's going to reduce injury to that cow, and it's going to really speed up your work time. If I have to spend 30 minutes chasing the cow all over the pasture, that's not really good for the calf. So figure out some form of restraint before you have a problem, so that we can get it taken care of in a timely and effective manner. And I have this little quote down here. Maybe you'll appreciate it. Just because she's friendly does not mean she'll appreciate my hand up her hoo-ha, because I sure wouldn't. So I don't care if you can pet your cow. Obviously not everybody has that kind of situation, but you need to make sure there's a way that we're going to restrain that cow and be safe about it. All right. So if you think your cow is stage 2 labor is taking too long, the first thing you need to do is restrain her, and then you can check to see if that fetus is in the correct position. If you're going to do that, I'm going to ask that you please wear gloves. Okay. I like to use breeder sleeves because they're nice and long. And then use a mild soap and warm water to clean up the back end of that cow. So you want to clean the vulva, the anal area, not just make sure you try to get as much bacteria out of the way before you go sticking your hand in there. You also want to use an obstetrical lubricant, buy it by the gallon. No such thing as too much lube. So you can use that to get in there. You're going to place your hand in there and you're going to feel what's in there. So Hopefully you will feel feet and a nose. Obviously there's, a lot of cases where you don't feel that. Sometimes we have a heifer and she's just not quite sure what to do. And, you have the calf in the right position and maybe she just needs a little assistance. That's fine. You can help. If you have 2 front legs and you have a head or just 2 back legs and they're attached, caveat, they're attached to the same calf. I've seen that too. You can put the chains on, the OB chains on, and you can pull. Here is someone in this picture is pulling a calf. He doesn't have gloves on, so shame on him. Please put gloves on. And the reason I harp on this is not only do your hands carry a lot of bacteria, and we want to try to keep everything as clean as possible. You can catch a lot of diseases from these cows, especially if they're aborting a fetus and need help. Like there's a lot of diseases you can catch. So I'm always going to harp on the gloves. All right. No questions yet. I must be explaining everything super well, or no one can hear me. I don't know. All right. So you can pull that calf if it's in the correct position. All right. Some tips. How do you tell if the legs are the front versus the back legs? Obviously, you can't pull a front and a back leg. I mean, you can try. It's not going to end well, but you need to have 2 front legs or 2 back legs. So the way I tell this is I'm going to palpate the leg joints. And so above the hoof, I'm going to feel that joint, and then I'm going to go up to the next joint. The next joint will be either the knee or it will be the hock. Okay. If both joints bend in the same direction, like on this picture, the picture to the left, that's going to be a front leg. If both joints bend in opposite directions, that's going to be a back leg. So a little tip for you. The right-hand picture kind of illustrates that. Those joints bend in different directions. And then we got to make sure those legs belong to the same calf. If you have twins, you might have a front leg from each calf in the vaginal canal. Yes, I've seen it. I don't have a tip for that other than you just feel up as far as you can go and make sure they're attached to the same body. So hopefully we can sort that out. I feel like that one's a little bit easier, but once you get in there, you're not going to know. So I use OB chains. I'm going to place these on the leg of the calf. So this picture illustrates an OB chain. You just place kind of a slip loop in it. And ideally you want to place your slip loop above the fetlock joint and then place a half hitch below the fetlock joint. What this does is it spreads out the pressure when you're pulling on that leg. You're less likely to cut off the blood supply and you're less likely to fracture that leg. So that's a very important thing. Okay, so let's talk about some abnormal presentations and what we can do. There are a variety of abnormal presentations. Here are some common ones. The picture on the left, we just have a head in the vaginal canal. Both legs are back. So we would have to try to get those legs up and into the vaginal canal. In the middle picture is a true breech, which means that we have the back end of the calf and no legs. Those ones can be particularly difficult. And then another scenario in the right-hand picture is we have 2 front feet and the calf's head is back. Now this calf's head is between his legs. He could also have his head back to either side as well. So what are we going to do? We come up to, we got our cow restrained into a chute here, and we're looking at the back end of her, and this is what we see. We see a foot and a head. Well, we need another leg, okay? So we have 2 of the 3 things we need. So how are we going to get that other leg? So the first thing, we're going to have to push that calf back a little bit so we can get some room to work. The first thing I do is I'm going to put an OB chain on the leg that I have, and possibly a head snare on the head, because the worst thing, it's not the worst thing, but the worst thing you can have happen is you push that calf back in there and you lose that other leg. So then you have to spend another, half hour fishing for a second leg that you already had to begin with. So always put a chain on things that you have so that when you push everything back, you can still have a hold of it. You want to use a lot of lube. I don't know if you can tell, this calf looks a little bit dried out. All that water that breaks when stage 2 labor starts is the lubricant for the vaginal canal and for that calf to come out. And so sometimes when they've been pushing a while, everything dries out. There's no more fluid in there. So you can just put lube all over that calf, all in that vaginal canal, and that will help everything go a bit smoother. So in this situation, I'd put a chain on that calf's leg. Depending on where the other leg was, I might put a head snare on the head. I'll show you the head snare in a second. And then I would push that calf back, okay, using one arm, and then see if I couldn't reach that other hoof, depending on where it was in the uterus. Just another reminder to please wear gloves. Please just wear gloves. Okay. I make it sound a lot easier than it is sometimes, but those are some methods you can use. This is just an example of a head snare. Yes, I know it's a horse, but I couldn't find a head snare on a calf. This is the bottom picture is just what the head snare looks like. And so this middle metal piece actually slides up and down so you can make it bigger or smaller. And so the way that you apply this to the head is you pass that cable around behind its ears, and then you tighten that loop up into its mouth, and then it's not coming off. Okay, you have that the calf's head. You can manipulate it however you need to. It's not going to be coming off. Okay, and I use that to guide the head out. Sometimes what I like to do is I like to have my hand. I usually have someone helping pull, and I have my hand on that head so I can guide it through the birth canal. But in some situations, if it's too tight for me to have my hand on top of the head, I got to have another way to hold on to it. And so the head snare is very useful. It has a little loop on the other end of it that you can attach the wire or the chain handle to, and use that to provide some traction. And usually that's all you need, maybe a human or two pulling on the chains, and that should be enough to get your calf out. Sometimes you do need some help with traction. It's not uncommon. Keep in mind that, if that calf's too big to come out, calf's going to be too big to come out. It doesn't matter how much traction you put on it. And so that needs to be evaluated as well. Because if it's too big, you got to go to C-section, and you got to make that decision early. The longer you wait, the more likely you are to lose that calf and to lose that cow. So making decisions in a timely manner is going to be crucial. If you need more help pulling a calf, a lot of people use a calf jack or a calf puller. And so this instrument is on the right side of the page. It consists of a very long, like a 6-foot long bar that has a ratchet device on it. And then at the cow end, it usually has a plate that you can see in the left picture. It braces against her rear. And then you can attach the OB chains that are attached to the calf's legs. You can attach them to the ratchet device, and you ratchet it. Some caveats about the calf jack. An unrestrained cow and with an attached calf jack becomes a weapon. It'll break things like your arm. So you need this cow to be in a chute or some other method of restraint, so they're not going to be swinging around all over the place. Okay. The other thing about the calf jack is you can provide too much pressure and really damage that cow or break the calf. So you need to use it. What we say is use it judiciously. And so what I'm going to do is try not to use it unless she's pushing. So what I'll do is I'll have her hooked up like the picture on the left. And then when she pushes, then I'm going to crank a couple places. And then when she stops pushing, I'm going to leave it. And then when she pushes again, I'm actually going to grab a hold of that bar and press down. That's going to provide a different type of tension. And we want to kind of press down when we're pulling, because that the birth canal is kind of curved like that. So definitely a very useful piece of equipment. Definitely needs to be used judiciously and carefully, because again, you can still damage the cow using this, but it can be very helpful. So given that, before your calving happens, the things you want to have on hand are going to be water, lube, breeding sleeves and gloves, OB chains and handles, and a head snare, plus or minus a calf jack. The calf jack's probably the most expensive part of that. It's probably like $200 to $300 for a calf jack. but I just would caution you, if you haven't used one before, to just be careful. So if you're trying to manipulate this fetus and you just can't get that leg up, and you can't get that leg up, and you can't get that leg up, call me. Call your vet. You want to give up sooner rather than later. If you're working, it's been 15 minutes and you're not making any progress, you need help. You need to do something different, okay? You can't just keep doing the same thing for 3 hours and expect a different outcome. It's not going to happen. So 15 minutes is a good frame of reference. You're going to have the best chance for a good outcome if you call early for both the calf and the cow. And there's a lot of things that I can do to make a dystocia easier. I can give epidurals. I like to use epinephrine. I like to use my stomach pump to pump lube into the uterus. I mean, there's a lot of different tricks that I have. I might have smaller arms than you, you know, you never know. Could be a number of things. And so don't wait on that. And definitely the do nots. Please do not attempt to pull the calf with a motor vehicle. I wouldn't say this if it hadn't happened, I hadn't seen it. So don't pull it with a motor vehicle. You will break that calf's legs. You will break that cow's pelvis. Please just don't. You never need that much. If you need that much horsepower to get a calf out, then you shouldn't be doing it. It should be a C-section. Okay, it's just not going to work. Don't use a come along. Come alongs are for fence tightening. If you don't know, at least a ratchet system. Don't use it. You can put way too much force on it. Like I said, even the calf jack can put too much force on, so you have to be careful. These things are completely ridiculous. Okay, so you don't need to do that. Please don't do that. And then finally, don't fail to restrain your cow. If you, even if she's down, she's laying down, oh, she's not going anywhere. And that's just when I get shoulder deep in the cow and she leaps up and runs off. Well, that's not helpful, and that's not going to have a good outcome for your calf. So restraint, don't use motor vehicles, please. Please just don't. All right, let's move on. We're going to talk about the newborn calf and what we need to know about these calves. Now, I realize that most of you have beef cows, so I don't know how hands-on or hands-off you are with your herd. You know, if your cow's calving out in the back 40 and you can only see her with binoculars, it's going to be hard to judge how well the calf is doing. But we're going to assume that you can at least get your hands on it and take that minute to see how well it's doing. All right. So a normal healthy calf should start breathing within 30 seconds of being born. Okay. It should start lifting its head within 2 minutes. It should start to sit up sternal within a few minutes. It should be trying to stand in 20 and be able to stand within 60 minutes. Okay, so those are our milestones for our calf. Sometimes we can get calves that are a little slower than this. That's not uncommon, especially if you've had to pull the calf. As long as that calf is in the birth canal, it can't breathe. Okay, it can't expand its chest to breathe. So if it's been like that for a little while, you're going to see a lack of oxygen, and so that can definitely be a problem. But this is the goals we're striving for with our calves. This is how they should go. So if you have had to pull a calf, you might need to resuscitate that calf. Again, they should start breathing right after birth. Whenever I pull a calf, because I generally don't know how long they've been stuck, I'm going to try to clear that airway. Okay, so that just means I stick my fingers in its mouth and wipe fluid out of its mouth, its nose. You can suction the fluid out if you have that ability. You can use those suction bulbs. You just need to have like a longer tubing on them to kind of suck the fluid out. I'm also going to try to stimulate a sneeze by poking the nasal septum, okay, with a piece of straw. So that's just the ridge between the nostrils on the inside there. You poke it with a piece of straw, hopefully they'll sneeze and start breathing. In general, hanging a calf upside down or swinging a calf around has been associated with detrimental and poor doing post-calving. So it's not recommended that we do that anymore. They shouldn't need it. They shouldn't have fluid in their lungs because they really don't receive that signal to breathe until they're outside in the air. So don't do those things. I know it's been traditional to do it. The calf we should get the calf dry. Now, a lot of times if we have that cow caught up in a chute, we're probably going to start the drying process ourselves. If that cow is out not on her own, she's going to do that by licking it. And that's really important. A lot of our calves are born in winter weather, and when it's kind of chilly. So drying the calf is going to warm it up. It's going to keep it warm. It's going to stimulate it to breathe. And then we want that cow to lick it as well. We want her to start getting to know her calf. So if you're still finishing up work in the chute, you started to dry off that calf, you can actually move it around in front of the cow so that she can start smelling it and hopefully licking it and taking care of it. Some people like to have calf warmers. There's a picture of one on this slide. It's just a big plastic kind of hutch. You put the calf in, and it has a heater in it, and it'll help dry them out and keep them warm. I don't know. It depends on how cold it is when they're having calves. So, but that certainly is an option that some people like to use. So a calf should start to stand within 20 minutes of birth and be able to stand within 60. Nursing should occur within 2 hours of birth. The first milk that the cow produces is colostrum, and it produces, that's all the antibodies that calf needs for immunity to a variety of diseases. So that calf should get colostrum. We're going to talk about that in a minute. Within 2 hours of birth, because those antibodies are only absorbed not even 24 hours after birth. We also want to make sure we dip the navel in iodine tincture. So you want to use the strongest iodine you can get. And I like to use these teacups pictured here with iodine, because it's real easy to just, pop it up under the navel and get it all covered. Just keep in mind, if you use something like that for the iodine, just like clean it out once in a while, because it can grow bacteria, but it's an easy way to get iodine on our calves' navels. And then we want to make sure we allow that cow and calf bonding time. Keep in mind, heifers sometimes have no idea what they're doing, and they may need extra time alone, but also sometimes they have issues. They reject their calf or whatever. So keeping an eye on heifers and their newborn calves is going to be very important. So we're going to talk a little bit about colostrum. Adequate colostrum intake at birth is going to reduce that calf's risk of infections, at least for the first 3 to 6 months. So the first milk, colostrum, contains antibodies that the cow has developed against diseases. Those diseases might be environmental situations, so things that your cow is exposed to on your farm, okay? And they could also be diseases that you've vaccinated them against. So hopefully you have some sort of vaccine program in place, and they're going to develop antibodies to those vaccines, like bovine rhinotracheitis, bovine viral diarrhea, and a bunch of other things, okay? So humans actually pass a lot of those antibodies across the placenta. So that's not getting colostrum is not as important. Cows and other ruminants don't have that. That's just the way their placenta is. They don't transmit antibodies across it. So the only way that calf gets that part of their immunity is going to be through colostrum. So again, unless you're really intensively managing these guys, how do you know if your calf got colostrum? If your cows are calving out in pasture, or sometimes even maternity pens, it's nice to try to figure out if that cow has adequate milk. We might be able to look at her udder and see that she's got adequate milk. Sometimes if they have a lot of mammary swelling, they don't necessarily produce as much. We want to watch the cow and calf nursing. Is the cow letting that calf nurse? If she has something going on like mastitis, she might kick that calf away. That's a problem that needs to be taken care of and addressed quickly. And the other thing that we can look for is if the calf is satisfied. The calves are going to nurse every 2 hours or so. If they're, always up and nursing or crying because they're hungry, that's definitely a problem and warrants further investigation. So calves should get at least 2 quarts or more, which is about 4 cups of colostrum within 4 hours of birth. That's our goal. The bigger the calf, they probably need a little bit more. If the calf cannot nurse for whatever reason, either it's got issues or mom has issues, we're going to want to use a commercial colostrum replacer. And so that's something that you should probably have on hand. And then that way, if you come across an issue, you don't have to run out to the store. You have it, you make it up, you give it to them. And note, I said replacer, not supplement. There's 2 types available on the market. A colostrum replacer is to be used in place of colostrum. The supplement is to be used with colostrum. So if you're having an issue and you don't think that calf got colostrum from mom, you should ought to be using that replacer instead of the supplement. And then again, if calves are, depending on their issues, if they're not getting up, if they're not nursing, you can always tube feed them that colostrum. So this is just a picture of someone tube feeding a calf. This is the kind of tube feeder I like for these guys. And so we're basically, it has a rigid portion of that with the ball end. You're going to put that into the calf's throat and then gently guide it down the esophagus. It's not super hard. You just got to restrain the calf. And then I like it because it has a clamp. You can turn it on and off and let it flow. So that's the kind of oral calf feeder that I really like. And you can give milk colostrum that way, you give milk that way, you can give electrolytes if they're not nursing. And so if you're having an issue with the calf, that can be a very important addition to your toolkit. So for newborn calves, our newborn toolkit you should have on hand should be strong iodine, ideally 7% tincture, but I think there were some issues with that on the market. Towels to dry it off. Have selenium on here just because some places have issues with newborns and selenium, so you may or may not need that. A colostrum replacer, milk replacer, nipples and bottles, a stomach feeder, and a thermometer so you take their temperature. So that's the basics of what you need for the newborn toolkit and what you need for having calves. That assumes they're going to be having the calves pretty well and not needing a lot of intervention. This is a picture of Yak and her yak calf, and I know it's not a beef cow, but a lot of this applies to these guys too. In case you were wondering. So we're going to talk a little bit about some issues that we can see with our calves and our cows after they're born, after they calve. Okay, so what requires veterinary attention? So newborns who fail to get up and nurse probably needs to be seen. Newborns that are unresponsive despite adequate warming. That's why you need that thermometer. If they're 96 degrees, they're probably not going to get up and do stuff. You got to get them nice and warm. Calves that are not nursing or lethargic, any fever over 102, that probably should say 102.5 is my cutoff degrees, and diarrhea. So these are things that we might need help with. I have these 2 pictures on this slide because I wanted to show you the difference between a cow that was hydrated and a cow that was unhydrated. And one way to tell this is to look at their eyes. So the picture of the calf on the right side, that eye, I mean, he's kind of rolling it down, but the eye is pretty flush with the bones of the skull. So you can barely see them around the pink rim of the eyelid. And then the cow on the bottom is dehydrated. I don't know if you can tell, but that eye is sunk back into her skull. So you can really see a prominent ridge underneath the eye. Okay, so that's going to tell me that cow is dehydrated. Same applies to calves when they're sick and they're not drinking well. So if you see that, and usually they'll be lethargic as well, that's a huge indicator that we need to get some intervention on that calf ASAP. A few newborn calf issues. Again, I can't cover everything, but some things I commonly see are scours, which is diarrhea, infection of the umbilicus, and septic arthritis. So this calf here in the picture is looking pretty sick. If you see a calf like this, it needs to be treated. I can't really tell that its eyes are sunken, but its ears are droopy. Calves' ears shouldn't be droopy if they're feeling good. So this one's definitely not feeling so hot. So calf scours or diarrhea is caused by a variety of bacteria and viruses. And you're going to have an increased incidence of calf scours with inadequate colostrum intake. So that's why we really need to make sure that gets on board first thing. Scours can be, mild, okay, just a little bit of runny diarrhea, calf still running around, big deal, feed them out of it. It can be severe. In severe cases, they really need to have fluids put in the vein for them to rehydrate them, antibiotics, etc. So a lot of times, if I have a calf with scours, if it'll take a bottle, I will continue feeding it its regular diet, but I will also add some electrolytes in addition to that. So maybe a couple feedings of electrolytes. I really like Resorb, so I have a picture of that on the slide. It's an electrolyte product for calves. You just mix it, pack it up in the bottle, and it provides electrolytes and glucose so that they have energy as well. A big note here is that a lot of people were taught not to stop feeding milk. So if you have calves that are on milk, a lot of people thought that it was the milk causing the diarrhea. Probably not. I mean, it could contribute, but not enough that I would stop feeding milk. Remember, their only energy is from the milk that they're drinking. So if you stop feeding them milk to try to resolve the diarrhea, that's not going to make any sense. How are they going to have energy to fight that disease? So don't stop feeding milk. Add electrolytes. Again, a lot of them will just take it in a bottle if they're not too sick. But if it gets severe, you're going to need to have a vet come out. So I like this chart because it just shows you calf attitude based on their percentage of dehydration. So the scale on the left side from 0 to 14 is your percentage of dehydration. Generally, once you become 14% dehydrated, you're dead. So that's generally bad. But you can see on the right side, the calves, as we go down, the calf that is not dehydrated is standing, is alert, looks normal. As that calf reaches 4 to 6% dehydrated, it starts to get depressed, its ears get droopy, its head's down, okay? Once that calf is laying down and not wanting to get up and its ears are droopy, we're in that 8 to 12% range, and that's bad. And that's why we generally do IV fluids on these guys to try to get them back on their feet. The thing that kills them is not the bacteria or virus that's causing the diarrhea. The thing that kills them is the dehydration and the metabolic acidosis. So they can manage the diarrhea. We just have to help maintain their hydration. Okay, let's talk about umbilical infections. Those are super common, usually because a cord hasn't been treated with iodine. Sometimes calves will have a normal temperature. All we have to do is usually just feel the umbilicus, and in this case, the picture shows an enlarged umbilicus. Umbilical infections are a common cause of joint ill or septic arthritis. So here's a picture of a calf with a giant knee. Septic arthritis or joint ill is an infection in the joints. And bacteria travel from other parts of the body through the bloodstream, and they will lodge in the joints and cause infections there. So that's something that you're going to need to call the vet for. Some of these require lancing the joint or flushing the joint and trying to drain some of that infection along with antibiotics. All right. Are we running out of time, Rich? I only have 6 more slides.
Yeah, we're at 3:50, so if you can get through those slides quickly, and we do have one question that came in, but I'll ask it when you're done with your slides.
Okay, so just we'll do quickly just some post-calving problems for the cow. A retained placenta is technically not considered retained until about 24 hours. You may need to help pull that placenta out. Sometimes the cervix starts closing and there's just a big ball of placenta behind it. You kind of have to help pull that out. Don't ever rip out that placenta. If you just go and you yank it out, you're going to damage the uterus, and you're going to have a cow that's not going to rebreed. And so a lot of times we need to give them antibiotics, and then we need to monitor them for a uterine infection, and that uterine infection is called Mutritis. Another common issue we see is a prolapsed uterus. This is often related to hypocalcemia, but can have other issues as well. We do see it more commonly in calves that have been pulled, so in dystocia cases. This is an emergency. It needs to be replaced. And even when we do replace them, there's still a high risk of hemorrhage and death after replacement. These are not fun, but definitely a concern. There's not a lot you can do unless you catch it while it's happening, and then you can stick your arm in there and hold it in place. You just got to call the vet and hopefully get that fixed. Mastitis. Our beef cows still get mastitis, just an infection of the mammary gland. Symptoms are swollen or painful udder, chunky milk, and a hungry calf. So keep in mind that mastitis is painful. So a mom, the cow is probably not going to let that calf nurse. So if that calf is hungry and not, for whatever reason, not nursing, you need to bring that cow up and check. And that cow might need antibiotics, it just depends. So that's something that you want to get treated right away. And then finally, Mutritis is an infection in the uterus. It's usually accompanied with a foul-smelling uterine discharge, as we show in this picture. Sometimes they'll be fine with it. Sometimes they'll have a fever and be inappetent. So that's something definitely to check for. And we can definitely fix it with some antibiotics and pain meds, but definitely have a vet look at that. Okay, and then I have some reference articles. These are just all online, which will have some more in-depth information about calving and taking care of the calf. So I just thought I'd put those on there. You should have gotten the handout. Rich should have supplied, and that'll have all that information on there, and you can use it for your own education.